All right, we're going to go ahead and get started. First of all, thank y'all for coming. I want to introduce to you a few people. Number one, I want to thank Miss Cindy Hyatt for kind of setting this up. This is Charlie's mama. And then Mr. Buck Strickland is going to be our guest speaker. I want y'all to understand, number one, how serious this meeting is. So I need all eyes focused on Mr. Buck in this presentation. And I know some of you, when you think you're a kid, you think you're invincible. This is a danger. This vaping, this juuling, it's serious. I want all eyes right now on me. This is serious. And right, and you know what's wrong. It's harder to do the right thing. But if you can stand up, I promise you more people will start following you if you do what's right. Now, fourth graders, I know this is kind of new to you, but y'all need to hear this because you're coming into it quick. All right, let's give Mr. Buck Strickland a big SGA welcome.
Thank you. Hello, everybody. Thank y'all for coming today. My name is Buck Strickland. I'm a PA. Anybody know what that is? Physician assistant. I work at Life Bright Community Hospital early, and I've been a PA for right at 20 years now. I was going to give a little background on myself. I started out working in the emergency room in Tifton, Georgia, and I worked there for about 3 years, and then from there, I went to work with a cardiologist 7 years and enjoyed it, but it was a lot of pressure. And a kind of colorful career. I got out of that, and the surgeons wanted to hire me with the vascular surgery. So I ended up working there for about 3 years, and then decided I liked emergency medicine and been back there for the rest of the time. So I ended up doing shift work in these smaller hospitals, so I'll work 24, 48-hour shifts, and then I'm off for several days, which is good, instead of the typical, 8 to 5, 9 to 5 jobs, Monday through Friday. But saying that, working in the emergency room over this many years, you can probably say I've seen not everything, but about everything. People coming in intoxicated on drugs, you name it, I've seen them come in on it. And so that's kind of what motivated me to want to do this talk, as well as talking to Cindy about the dangers of vaping. So it seems innocent, you buy this little gadget over the counter, you get it from your friends, and then you start trying it. It tastes good, they've got all these flavors in it, they make it easy for you to get, and it makes you feel good initially. And talking to some teenagers that use it, they don't think it's any big deal. And smoking is just as bad. But a lot of these things, they have over 7,000 chemicals in that fluid that you're putting in your lungs. And article after article I've read recently, they don't know what the long-term effects of these chemicals are. So it's so new, a lot of the research isn't there to back up, the harmful effects on your body. But like your headmaster was talking about, it's dangerous. It seems innocent, easy to get, but it's very dangerous what you put in your body. And he's right. These people I've seen come in the emergency room on drugs, I talk to them, when they calm down or the drugs wear off, I'll ask them, I'm like, when did you get started on this, or how'd you get, what got you? And 9 out of 10 of them, they want to be off of it. They hate it, but they're handcuffed to it. They can't get away. And this stuff over time, it'll steal a little piece of your life away every time you go back and do it. And it's not your fault. You're smoking these chemicals, it makes you feel good, but it sneaks in, and then you say, woof, I got to have some more. I'm starting to feel bad. I need another fix, or I need another puff. And before you started vaping, you're out there, running on the baseball field, running around the yard, feeling great. Then you get on these vapes, and these kids come in, and they're I'm out of breath. I can't do what I used to do. And you guys and girls are young. You shouldn't be having these kind of problems. But it takes your lung capacity away some. And then you feel bad. You're like, I got to do another vape to feel good. And then that's the addiction. You keep doing more vapes. Next thing you know, you're doing 30 or 40 vapes a day, and every time you do that, chemicals are going through your lungs into your bloodstream, into your body, giving you that effect. And it's so addictive. That's what the power of the nicotine is. And all nicotine comes from the tobacco plant. It's an extract from that. Been around since the earth was formed. But the plants and animals, but the nicotine they put in these jewels specifically is what a lot of the teenagers are using nowadays. It's one vial is equal to about 20 cigarettes. So you're smoking a pack a day when you finish that jewel. It's a pack a day. And I don't even have patients that smoke a pack a day that are older. And some of them do, but that's what's in that little container. That's how much nicotine is it. So what does it do to your body? Well, it makes you feel good at first. It gives you a little boost. You feel good, and then it relaxes you. But then after that is when it starts wearing off. It makes you agitated. People complain of headaches. They complain of feeling jittery, stressed out when they really don't have anything to be stressed about. They just feel kind of tense all the time. And then can lead to depression. A lot of children I see nowadays fight with that. I think it just in general, being a teenager, you're going to fight with depression here and there, peer pressure and things like that. But you don't need something else making it worse, you know what I mean? So it boosts you, it kind of tricks you, you feel good, it makes your body feel good, and like I said, then it calms you and it wears off, and then you get all these anxieties, and depression can get a lot worse on these things, believe it or not, especially if you have them and then you use them and then, oh my God, I left it in my bag, and you go on a trip and you don't have it, you'll go through withdrawals. It's literal withdrawals. The chemical is not in your body, and you feel shaky, and you can get depressed even worse. Who needs that? So that's just kind of an overview of how they react with your bodies. But going back to it, talking to these people, a lot of them got started on the harder stuff by cigarettes, and that was the old way. And then they used to smoke the unfiltered, which was 1,000 times worse for you because of all the chemicals. But the new thing is the vaping. So I guess my point is that everybody that started into the hard drugs, they started smoking, or it was vaping. It was that particular thing that got them to say, well, I can handle this nicotine fine, and it's not doing it for me anymore. I don't feel good on it. I'm going to try something stronger. Don't go there, because it gets a lot worse. And I've seen it destroy people's lives. And like I said, these people I talk to, that's one thing. They're chained to it. They want to get off of it. And they got into it just the way you guys, if you're experimenting with it, it can lead into other stuff. I don't care what nobody tells you, because I see it. I've seen it for 20 years. It doesn't matter if you're CEO of a company, or you're out helping clean up people's yards for a living. It will take you down. It don't matter who you are. I've seen it. So that's where I'm going to start. But the cases I've seen that are the worst, or the effects on vaping is still so new, they don't know a lot of the effects, but smoking are the health risks, which are cardiovascular disease, which basically means it clogs up the arteries around your heart and in your body and predisposes you to have a heart attack at an early age. If you smoke long term, it creates a condition called COPD, where it causes the lungs to where they won't expand and they lose their elasticity, And so you have like a barrel chest, and you see these people on oxygen, particularly a lot of the veterans were heavy smokers, and you know, that's the problems they have, are the lung disease and stroke and heart attack. So the risk of doing the vape on your body, the physiology of it, so you do a vape or two, and I were to check your blood pressure and pulse, it'd be 120/70, your pulse would be, you know, 75, that's normal, and your respiration is around 20. Basically, you do 1 to 2 puffs on this thing, and I set you back down, your heart rate's going to go up to well over 100, usually about 105 to 120. Blood pressure shoots up, usually around 140/90 or higher. So you say, what's the big deal in that? Well, if you're young now, but like it jacks you up, and even at your age, it puts you at risk for a stroke. I've seen some evidence of people smoking and vaping, and it'll cause such a rush in their adrenaline and the nicotine effects on the nerves. It can raise your blood pressure, and it can raise your heart rate. So if you're vaping and you feel your heart racing, you know that's the nicotine. And the thing is the concentration of it is so strong nowadays, so you got to be real careful with that. And not just for you students, but anybody vaping. But the statistics now are showing that in the high schools, it's getting younger and younger age. The children are starting it at, you know, in middle school, and they're seeing you seniors and juniors, they see y'all smoking a vape, and they get curious about it. So you got to be a role model, you know. You got to think about these things. You don't think about them at this age, I know, because I didn't much, but they're looking at you, so you want to be a good example. So the numbers are going pretty high in the middle schools, is particularly the juniors and seniors. Let's see if I can find this research here. It was showing that, this is according to the New England Journal of Medicine, between 2017 and 2018 in the United States, there was 1.3 million additional nicotine vapors. That is unreal. The studies I had before that were from 2015 and showed that there was between 2011 and 2015 a 21% increase, but it has just exploded in the last 2017 and 18 because they make them appealable to you all. They make them, yeah, go ahead. They make them taste good, the flavor's good, and you feel good. So this is kind of talking about how, I've already talked about how addictive it is, but the epidemic is high school children. Also, they were saying that it was like the largest year-to-year increase in substance abuse, talking about the vape and nicotine, ever recorded for 10th and 12th graders, students. That was between 2017 and 2018. So it's a trend, no doubt, and you know, social media is going to make it cool. They're going to send ads out, and it's just like those phones, you know. Everybody's addicted to that iPhone or the regular phone because it's fun. It takes your mind away. Even me, you know, I'm somewhat addicted to these phones. I have to put that thing down and walk away sometimes. But, you know, I get it. I get it why it's appealable to y'all. But my job is to tell you how dangerous it is so you can make an informed decision. So I skipped to the next. This is an example, I think, of one of the Juuls. And this is just the standard e-cigarette. And that's the one that's dangerous. It's got the high nicotine. So one pack of cigarettes, 20 cigarettes is in that one little device. Okay. This is, what's that look like in the lung? Popcorn, that's right. All right, hold it right there. This is a bronchial tube. These are the smallest tubes in the lung. So this is a normal person versus a person that's been vaping a long time, or they could just be vaping for a month and this happened to them. And it's where the internal lining of the lung gets inflammation because those chemicals are touching the mucosal membrane, and it's making the tissue get inflamed and swollen, kind of like an asthma patient or patient that's got, you know, bronchitis. So you don't have to do anything, and these chemicals are acting on your lung like that. So why do they call it popcorn lung? Well, that gets back to the chemicals in the e-cigarette that is called diacetyl, and it's a chemical. Back when they were making at the popcorn plants, they were putting this flavor in the popcorn to make it taste better, more buttery. Well, it's called diacetyl. Then they noticed that all kind of workers from this popcorn plant were getting this popcorn lung. They were getting the inflammation. They couldn't figure out why, so they finally isolated it to that flavoring, which is the diacetyl. And so then they did away with it. Everything got better. Now, guess where they're seeing it again? Vaping. Because the chemicals that are in the liquid has the diacetyl in it. So that's what makes the flavor. Like it made the flavor in the popcorn, it makes the flavor in the cigarette taste good. They do all these fancy flavors, but that's the chemical they need to make it taste good. But that's what that chemical can do to your lungs. So they're seeing a resurgence in it. So that's another, you know, bad health problem you can get from them. And you can get it from just smoking them a week. Some people are more sensitive to it than others. So if you guys and girls notice yourself get this hacking cough you never had before, could be that. Popcorn lung. Okay, go ahead. This is a technical slide, but this is a CAT scan slice of a normal lung, which is at the top. Those are tissue of your lung. The black part is the air, and in the middle is your heart and the vessels. But you can see a definite difference between C and D, and that's from someone's vaping. I think it's at about a year, and it's how it thickens the bronchial tubes, and it causes your, you know, this chronic cough, shortness of breath. And these patients, they say they feel bad. I just don't feel good, you know. I can't figure out what's wrong. That's probably that. Just chronic fatigue. Okay, go ahead. So these are just some quick facts on the consequences of smoking, which to me, the smoking, cigarettes, and vaping are kind of go hand in hand on the risk, like we talked about with the heart, lungs. Other things I didn't mention were it decreases your immunity. They've done research on smoking in general, but the vaping also depresses genes that release immunity cells. You've got these called macrophages in your body. They're like the lone soldier that walks around in your tissues and fights off bacteria and kills organisms in your nasal passages and things. He's like the watchman. Well, it prevents you from getting sick a lot of time. A lot of the macrophages do. Well, the vaping and smoking depresses these by affecting the genes that control it. So basically, they make your immune system lower. So you catch colds, you can get sick a lot easier. Here's the big one that I knew about, but I hadn't read a lot. It alters the nerve cell functioning in teen development. So at your ages, your brains are still growing, maturing, learning new things, making pathways. Well, they've done a lot of research, and the vaping slows that down. So it's definitely not something that's going to make you smarter. So just keep that in mind. It can affect your behavior. Like we talked about, it can make you depressed a lot more than you normally would be, or agitated, you know. It's like, what's wrong with you? He's just bit my head off. It could be withdrawals from the nicotine and vaping, or just not being able to sleep, things like that. You might not key it back to that, but, you know, basically it comes down to things you put in your body. I was talking to one of my friends about, you know, artificial sweeteners and things like that can make you feel bad. So the bottom line on a lot of this is diet, exercise. what you put into your body. You put good stuff in your body's going to feel good. You exercise your body's going to feel good. If you put bad stuff in your body, you're going to feel bad. You'll feel good temporarily, but it won't last, 2 hours, 4 hours, and then you got to do it again. And to me, that's being handcuffed to something, That's letting it control your body. Y'all are young, bright people. You don't need to let those chemicals and things control your body like that. This is just showing the smoking-related deaths. This means people die from smoking side effects, and like we talked about it, forming blockages in your arteries. So heart disease is number one, 160,000 deaths per year. Number two, lung cancer, which vaping can cause that too. Pulmonary disease, like we talked about, the COPD. Other cancers like oral cancers, and strokes, and other diagnoses, autoimmune disorders and things like that. So this is a fellow that had oral cancer from smoking, and they had to do surgery on his face, and it disfigured it. And we see people like this here and there. Tracheas, where they have to breathe through a tube from these long-term smokers. This fellow, I think, was a smoker, and he dipped, which dip is terrible. He had to reconstruct his jaw. But he lives. A lot of them die. If you get an oral cancer that's bad enough, it can kill you, even at young ages. This is another guy, I think, that smoked. It forms sores that won't heal. So if you ever get a sore that doesn't go away in 2 or 3 weeks, an average bite or whatever that, it's going to get better in about a week or two. But if you got a persistent sore, get it checked out. So this is what I was talking about, the handcuff to the cigarette. You don't need that. Nobody needs that. You want to be your own person, and you don't want to be a prisoner to anybody. Nobody wants to be a prisoner to somebody, but that's what you are when you vape and smoke. And there's all kind of other addictions out there. But so stop smoking, stop vaping. You'll live a lot longer. You'll feel a lot better, and you'll be an excellent example to the younger people too. Thank you.
All right, are there any questions for Mr. Buck? Adults too, if you have any questions, teachers.
Point I forgot to add was the chemicals. We were talking about there's 7,000 chemicals in the vape fluid, but one of the big ones are called aldehydes, which if you study chemistry, in high school chemistry, you'll know what those are. Well, in medical school, they preserve bodies in formaldehyde, and we had to do gross anatomy where we dissected them and all that, but it pickles you basically. So when you're smoking these vapes, they have those aldehydes in them and formaldehydes in them. So that's putting into your body, so that's no good for you. It can kill your cells in your body, your lung cells and all, and can kind of pickle you if you do it long term. So just remember about the formaldehydes too. Those is one of the bad chemicals, and that the flavorings have bad chemicals, and so does the. It's basically the water vapor and then the aldehydes from all the other preservatives they put in it, so it'll be stable on the shelf of the grocery store or whatever for a period of time. So that's another one of the big ones if you wanted to read about vaping and the formaldehydes that could get your attention too. Yes?
What should you do if you see somebody vaping?
If you see somebody vaping and you're at school, you need to let somebody know about it because they're not supposed to be doing it from what I hear. Let your teacher know, or if you're just out and about, you know, and you know them, to say, hey, man, that's not good for you. I've been to a talk, and they said that stuff is bad for your health.
That's a good question, especially to you younger ones. If you walk into a bathroom and you see one of these older ones doing it, you come straight to me or your teacher and let us know, because that's happening. So you make sure you let them know, and the teacher or nor myself will ever tell who's telling on one of the older ones. That's not telling on them, that's helping them. Any other questions? Just looking at that one picture of the young guy on the right. Go back to that one. That one right there. Go back. Go back. That one. I think most of the teachers and adults could say the same thing. I think when you're young, I mean, you're living life. I mean, I'm going to use I played small college basketball. It wasn't that great, but I played. But I can remember playing, and I thought in my mind I could play basketball till the day I die. And some of you older boys, Pickle, you probably think that too. But one day you're going to get bigger, you're going to get real out of shape, and it's going to be gone. And I look at this kid, I know that's a totally different analogy, but I can promise you in this picture right here, he's at a wedding, he's at a party, he is living life, enjoying life, not ever thinking this is going to happen 15, 20, 30 years. I think all of us, me included, if I could look down my life and look at something I start back in high school or college and see what's going to happen 30, 40 years from now, every one of us would probably change the way what things we're doing or what things we're saying. And I know peer pressure is a big thing. Peer pressure is a big thing when you get old. That doesn't go away. The only difference, usually when you get a little older, you're not trying to fit in, and you really don't care what everybody thinks of you. I know in high school, middle school, even elementary, you're trying to fit in. Some of you are juuling and vaping, and you're probably going to continue it. Some of you are sitting right now, and you're thinking about trying it, or you've tried it, and the only reason you're doing it is for one reason. Because Johnny's doing it or whoever's doing it, and they're kind of cool and they're kind of putting a little pressure to you to do it. Try your best to be strong in saying no to that. And then I know some of you are sitting there thinking right now, I wish this was over with and I could get back to class, and I wish they would shut up. I hope you're listening to what Mr. Buck said, because this is real. And I know you think what you do today will not affect what's going to happen tomorrow, but it will. And it'll be just like that. For long, you're going to be bigger, and you're going to be 40 years old like me. You're not always going to be this young spring chicken. So try to do what's right at all times. I don't mean you're going to make mistakes, but try. And you young ones, 4th grade, 5th grade, 6th, 7th, you're the ones that have to make a change. Because if you make the change, the ones in the lower grades, they will make the change. But some of you are already making the wrong choices at a young age. You've got to go back and do what's right. Any other questions before we dismiss? All right, let's give Mr. Buck a big hand. All right, we're going to dismiss 4th grade first. In 5th grade over here. Thank you for coming. I appreciate it. Thank you, Miss Cindy. That was perfect. You were great. Hey, Parker, what class y'all in right now? What about you? Go ahead, Mr. Ray. Go ahead, Banks. Go ahead, Miss Jamie Burke. Juniors, seniors, boys. Hey guys, junior, senior boys, y'all go to my office.